Our company, which is headquartered in Philadelphia, started over 35 years ago. We were a pilot program that the Sisters of Mercy in a hospital in West Philadelphia, in a spare closet, launched a pilot program to see if they can make an impact on the poor as it relates to their health care. Today, our company serves over 5 million people in 12 states in the District of Columbia. And what we try to do is to help people access the healthcare system so that they can live healthier lives. Our company wants to help the underserved achieve their American dream. And that means, by starters, being treated equally, which I think in these recent times we've come to appreciate even more the importance of respecting equality in this country. And from there, to be able to pursue life, liberty, and happiness, like we have all heard, starting with the Declaration of Independence. And so to be the leader in empowering people to achieve that type of a vision, it's an amazing job to have every day, to walk into this company and to try to do that. The people that we serve are Americans looking for access to healthcare, looking to have greater opportunities. And so their moms and dads, their children, their grandparents, their veterans. The faces of Medicaid are the faces of America. One of the things that inspired me and inspires everybody in this company is that when Medicaid was created over 50 years ago, Lyndon Johnson, when he signed that legislation, he said something which was pretty profound and so important that we put it on the wall behind me when you walk into our headquarters, and we've put it on every single screensaver for every associate in this company. And what Lyndon Johnson said that day was that it calls upon us never to be indifferent toward despair. It commands us never to turn away from helplessness. It directs us never to ignore or to spurn those who suffer untended in a land that is bursting with abundance. And I think the it he was talking about is what it means to be America. That in a land that has had so much, that it's who we are to not turn our backs on people when they're in need, when they're not healthy, or when they're having a challenge achieving their American dream. And so our vision, again, is to be the company that helps people in their communities achieve that. And we feel really privileged to do that every day. There's two key things that I think people should bear in mind about Medicaid with the pandemic. First is there are 40 million people who've lost their jobs and presumably have also lost access to health care. Medicaid is a program that has been there for people in times like now, times where they're challenged by economic hardship. And we're working with our state partners to make sure that we'll be there for people who will be new to Medicaid. Nobody likes being out of work and needing to have to all of a sudden figure out, where am I going to get health insurance or health care? The Medicaid program for over 50 years has been there in times like now. The second thing, though, that's just as important is that it underscores the pandemic, the challenges of those who we have been serving before the pandemic. People who are Medicaid beneficiaries have challenges with access to transportation, access to fresh food, job training. We call that the social determinants of health. Well, social distancing has been more challenging for people who don't have access to transportation and can't get out to a store and buy food. They don't have the ability to maybe have social distancing because many of our members live in very dense, populated areas. And so the health outcomes for people we serve because of the pandemic have been greater. The mortality rate for Black Americans has been 23%. Well, it's almost twice the amount of the population that's represented. And that is a direct outcome because of the way the social determinants of health already impact the minority community, and that's been magnified as a result of the pandemic. Yeah, ultimately, there are disparities, there's inequities in terms of things as simple as where somebody lives. Your zip code can really make a difference in terms of how long you will live. Uh, People have different access to education and to opportunities, let alone the social determinants of health that I mentioned, like food. And so people have to overcome the fact that they may not be getting the best education as somebody else. They may live in an unhealthier area or an apartment complex that might be less healthy. Over time, that takes a toll on people, where you live, the type of food you get to eat, the type of opportunities that come your way. That all plays an impact on people's lives. But we think that working in Medicaid, our company has an opportunity to really make a difference in overcoming those inequities. Well, where we start is on a person-by-person basis. I always say it's a grassroots business. We work one person at a time, one community at a time. And we look to work with each member in helping them craft their own journey, trying to not only get them to understand how that they can play a leading role in their own health, but beyond that, to help them also understand how they can overcome those social determinants of health and craft a journey that will give them their American dream that they want, and along the way, they'll live a healthier life because they've learned about how to have the right type of a diet, how to overcome the transportation insecurity issues, job training opportunities. We work with many of our members to help them get a high school diploma equivalent, a GED. Well, that is proven to lead to a better paying job. And a better paying job can lead to maybe living in a safer, better environment, which ultimately leads to a healthier and happier life. And so we start with the basics, but we widen the angle of the lens to make sure we cover all of those things for our member. I've been a firm believer that the healthcare system, as wonderful as it is, was not necessarily designed with the individual in mind. We created a system and then we told people to learn how to navigate it. If you remember the original iPod, it had a click wheel on it and it was very intuitive. If you wanted to figure out what kind of music you wanted and to arrange your playlist, behind it was a lot of technology, very complicated, something that I will never be able to figure out. But think if we made people arrange their music by coming through the back of that iPod, as opposed to the front where it's simple and easy to understand. That's not how the healthcare system works, let alone these other parts that affect the healthcare system. And so what we've been trying to do in our company is to develop a business model that is going to help our members have a seamless, simple way to interact with the healthcare system that is about them, not about us, not about the healthcare system, and you have to figure out how to navigate us, but we have to figure out how we help you navigate all the different aspects of your life, from healthcare to your education and to pursuit of your American dream. And that's really what has inspired us. You know, over 20 years ago, we developed what we called then our integrated model of care. And we think we were one of the first at the time where we decided we were going to manage in an integrated fashion the physical health of a member along with their pharmaceutical needs and their behavioral health needs. And many people followed suit after we did that. About a couple of years ago, we realized that there was time to come up with a new model of care. And we launched what we call our next generation model of care. And we decided that, and we announced that we're going to manage the social determinants of health on a member-by-member basis. And we're not going to just focus on the member, but we're also going to focus on their caregiver. There's over 40 million volunteer caregivers in America who are walking around with a 3-ring binder with handwritten notes about the neighbor, the loved one, the friend that they are helping on the side as they live their own life. And it's a frustrating, tiring job with not a lot of resources. And we have decided that our next generation model of care is going to make sure that we can support those caregivers as they support our members, and as we take a very holistic approach to helping our members overcome the challenges that they face in getting to a healthier life. Well, I think that for starters, we have to not think of ourselves as a healthcare payer. Because our mission, the challenge we face is broader than that. And in turn, we have to get other like-minded organizations and partners to think the same way. We have to think outside the box and work backwards from solving the challenge, the problem we have. And so it means we're gonna have to partner with new and different organizations that we haven't partnered with in order to focus on the non-healthcare aspects of our members' lives that are ultimately affecting their health outcomes. And we need to come to the table with an open mind and a broad vision, and we need other organizations in our communities who we work with regularly to come to the table with the same mindset. I think we have to have an honest conversation that the way we've managed things in the past, while it's been very successful on a number of levels, to give hundreds of millions of people over the last 50 plus years access to the healthcare system, we still haven't gotten at some of these root issues that poverty continues to be a problem. And we believe that our company has to think outside the box and be something different than a healthcare organization. We think that we can be a pathway for people to achieve prosperity, for people to live more independently if they're disabled. And we think that an investment in the people that we serve, an investment in the Medicaid program, is an investment in America. We all will thrive. We all will be the country that we all want to be when all of us are enjoying as much as we can the life that we want to live. And so if you're challenged by poverty or challenged by disabilities, we have the opportunity to do something about that. But it means having a different type of a conversation and looking at the true problems that we're trying to solve and working backwards from that. I think the biggest thing that policymakers and decision makers in government could do to help us on this journey is to look at this in a completely new and more holistic way. Not taking anything away from the programs that have been created and that we've lived with for decades, but sometimes you need to change. And we need policymakers to be open-minded to new approaches and to not feel that we have to solve a problem the way we've always solved it. Because this is not just a healthcare problem. It's a healthcare outcome, but the problem is much bigger than healthcare. And is really are issues about social impact and whether people of all races and walks of life have the same opportunities that America, as we've always thought it was defined, is meant to be. And that will take a different way of thinking than perhaps we've had over the last several decades of the current program. Well, a greater investment in Medicaid has proven to be an investment in America. About 10 years ago, when we were in the Great Recession, it was Medicaid expansion that proved to be one of the greatest triggers for the economic recovery that came after that. And it's not too complicated to figure that out. If you invest in people, if you invest in the healthcare system, in the case of Medicaid expansion, you're helping people stay healthy. You're helping them hold on to a job. You're helping rural hospitals, which are typically the biggest employer in a town, to still be vibrant, making an impact on the community. And that has a ripple effect around the communities, around the states, and around the country. So it's probably one of the most effective and measurable investments that we can make as a country. The risks of inaction are enormous. It means that we're comfortable that your zip code can determine whether you live 10 years longer or not. That we would be comfortable with all of those inequities and disparities that are inconsistent with what we all believe this country's about. And I think you don't have to look much past recent events in the last few weeks in this country to understand there are issues about race in America that we need to solve, that we need to talk about as a country. And we have an opportunity by investing in Medicaid and thinking outside the box on how we might want to restructure the program, how we help people overcome the challenges of poverty, the challenges of living with a disability, and at the same time to maybe talk about the challenges of race in this country. And so inaction, to me, would be a terrible thing. We can solve a lot of the challenges, including the challenges we've experienced recently. So let's have that conversation and let's be comfortable in terms of where it may go. It may mean we're going to redefine the system in different ways. And I would say that having different systems as an outgrowth of having an America where everybody is equal. In the Constitution Center in Philadelphia, not too far from our headquarters, outside on the wall says, "We the people." And it says, "We the people." There's no asterisk. It doesn't say, well, only some of the people, or not minorities, or not people who are overcoming poverty. It says, "We the people," all the people. Let's just work backwards from we the people. Let's build a country, let's build an economic system, let's build a healthcare system that ensures that we the people means everybody's included. Well, I would say to all of you who are chief technology officers or other people in that space that you have an opportunity here, not just my company, to be part of a solution. Your company may already be related to healthcare, but there may be other things about your organization that could play a part. We all need to own this issue of equality and of making sure that everybody gets to truly have an opportunity at the American dream. And so I would ask you, as you go back to your companies, to think about ways that you can get involved with this. And certainly feel free to reach out to me if you need ideas. But the way that we're going to overcome these challenges is by doing it together. And I hope that all of you today got a sense of how you can play a role in this. It's that important. Thank you for listening.